Hey, you guys, it's Dr. Kimberly Gartman here. It's time for 5 Minute Friday. I'm so excited to be with you today and for what we're going to talk about today. So, what we're going to talk about today is green tea, and I'm really excited to talk about it because it has a lot of great health benefits, and also it has been extensively studied in human beings. So, I feel very confident in sharing this information with you. A lot of our supplements we know have beneficial properties, but have largely animal studies and not a lot of human data. And so we have to just extrapolate, and that can be problematic. But with green tea, it's different because we actually have good human studies. So I'm really excited to talk about this with you. So what is it about green tea? Well, green tea is rich in something called polyphenolic compounds. And the main component of that is catechins. And what those do is act as antioxidant. They reduce oxidative stress on our body, and what that is just the bombardment that we receive from toxins in our food, in our skincare, in the air we breathe, stress. That all causes oxidative stress to our cells, which makes them not work very well, causes inflammation in our bodies, can turn on cancer genes. It can wreak havoc in our bodies. And so what these compounds do is reduce that oxidative stress. They work as a potent antioxidant. They also are anti-inflammatory, which is really exciting. They're anti-carcinogenic. And all that means is that they reduce the risk of cancer cells being formed, because carcinogenic means cancer causing. So anti-carcinogenic means cancer reducing or against that. Anti-arteriosclerotic, say that 3 times really fast. I'm going to talk a little bit more about that in just a sec. And then also some antibacterial properties. And so I'm going to tell why that's important here in just a second too. But the first thing I want to talk about is the vascular issue. So now we know that a lot of the vascular disease that we have, the heart problems, risk of stroke, brain issues as far as memory, and what we used to call hardening of the arteries, now we'll call small vessel disease, but it causes like a dementia that basically acts like Alzheimer's disease. We can have problems with our kidneys because of our blood vessels, and also our gut and our legs, anywhere you have vascular supply, basically. And so what these compounds do is they improve vascular reactivity. So our blood vessels react better to stress. It improves the endothelial lining. So the lining inside of the blood vessels, it helps that to be in good condition so that it doesn't get little gaps or inflammation in there. And that the gaps and the inflammation that happen in there are what cause us to have plaque formation or clot formation. It can cause the heart attack or the stroke or the kidney damage, so on and so forth. And so it's really important for that. Also can lower the harmful LDL cholesterol, so very beneficial there. There have actually been several large population-based studies. So that is where it's not a clinical trial, but they go back and look at the diet, exercise, lifestyle of people, and then extrapolate that data. And what they have seen in several large studies, or population-based studies, is that people who drink green tea, specifically also black tea, but more green tea, have a reduced risk of cardiovascular incident. And so they're not like hanging their hat on that, but it really looks pretty convincing as far as green tea and its benefits as far as your heart and your blood vessels go. It also inhibits reactive oxidative species. And what that benefit is it helps to restrict damage or prevent damage to our DNA and RNA. And that's our cells. I mean, that's how our cells work properly. When our cells divide, we need our DNA to be intact, because when it isn't, when it gets tweaked a little bit, that's when the cancer genes get turned on and cells proliferate in an unhealthy way, causing cancer. So we don't want that. And then lastly is the antibacterial effect. So specifically in our mouth. So it can help prevent like cavities and gingivitis and gum disease because of the antibacterial effect in our mouth. So there's very little harmful effect. I mean, you don't need to drink 10 cups of green tea a day just because of the caffeine in it. But I will tell you that the cardiologists in our area that I greatly respect are recommending to their heart patients that they drink green tea every day. And there's very little to say that you shouldn't. So as always, check with your doctor if you have some health issues. But in general, there's no reason for you not to have at least a cup of tea of green tea a day. And then after this, I'll list a couple of other places that you can get some green tea without drinking a hot cup of green tea if you're interested in that. So thank you again for joining me for 5 Minute Fridays.